Good afternoon. This is Freeholder Director Sylvia Patillo, and I would like to thank everyone for joining us this afternoon. Before I begin this special meeting, I'm going to call the name of each freeholder, our BA, and Mayor Michael Lenz Ak from Andover Township so they can identify themselves. Deputy Director Dawn Fantasia?
Here.
Okay. Freeholder Anthony Fasano?
Here.
Freeholder Herb Yardley?
Here.
Freeholder Josh Hertzberg?
Here.
Our Business Administrator Greg Poff?
Here.
Okay. And Mayor Michael Lenz Ak from Andover Township?
Here.
Thank you very much.
It blows open.
Due to public, before we begin, if you would mute yourselves unless you're talking, it would be helpful so we don't hear all of that background sound as we move forward with the meeting. Thank you so much. Due to public health issues arising from the coronavirus situation, the Sussex County Board of Chosen Freeholders will conduct this meeting remotely via a telephone conference call. County residents are invited to listen and will have an opportunity to make comments by calling 973-310-7191. This is the special Sussex County Freeholder meeting, May 6, 2020 at 2 p.m. in the Freeholder meeting room. I'd like to call this meeting to order. Terry, would you please call the roll?
Freeholder Fantasia? Here. Freeholder Fasano?
Here.
Freeholder Hertzberg?
Here.
Freeholder Director Patillo?
Here.
Freeholder Yardley?
Here.
Okay. As we stand for a moment of silence, let's all remember the families who lost a precious one during this pandemic. And please join with us in a salute to the flag. I pledge allegiance to the flag
Of the United States of America.
to the republic,
And to the republic which it stands,
one nation, under God, liberty,
and justice for all.
Thank you. Pursuant to the Open Public Meetings Act, Chapter 231, PL 1975, adequate notice as defined by Section 3D of Chapter 231, PL 1975, has been made by regular mail, such notice being submitted on May 1st, 2020, from the Administrative Center of the County of Sussex, located at 1 Spring Street, Newton, New Jersey, to the following: New Jersey Herald, New Jersey Sunday Herald, Star Ledger, WSUS Radio, WNNJ Radio, and is also posted on the bulletin board maintained in the Administrative Center for Public Announcements and has been submitted to the Sussex County Clerk in compliance with said act. Before we approve the agenda, I would just like to acknowledge that today is National Nurse Appreciation Day, and this week we also celebrate the Teacher Appreciation Week, and we are grateful to all of our workers and our nurses, all of our healthcare workers, and we are grateful, of course, to our teachers who are working hard to carry on and help the education to continue to move through social media, which is not an easy chore. At this time, could I please have a motion to approve the agenda?
So moved. Fantasia?
Second?
Second, Anthony.
Okay, is there any discussion? Not hearing any. All in favor, please signify by saying aye.
Aye.
Okay. As we look through the agenda, number 6, 7th, and 8th are not going to be on this agenda for today. So we can look at number 8, which is the public session from the floor. Now, before we open the public session, we ask callers wanting to make a comment to first state your name and municipality. The clerk will create a roster and will call each one in the order of their names were received. Comments are limited to 3 minutes or less and must only address issues regarding the agenda items. If you would like to speak on an issue that is not on this agenda, there is a public session at the end of the meeting that allows you to do just that. So would you please state your name and municipality if you would like to speak on the agenda.
Yeah. Matthew Cable, Freedom, New Jersey.
Okay. Is there anyone else? Okay, not hearing anyone. Could I please have a motion to open for the public?
Oh, I thought I heard another gentleman.
Oh, is there another person, please? Okay, I don't hear. Is there anyone else that would like to speak on the agenda?
Excuse me, I have a question for you. My name is Abby Bruss. I'm calling from Mars County. Depending on what is said, I might have questions on the agenda. So would you like to put me down?
Okay, well, right now you're speaking before the agenda, so you probably won't have questions until after, which we have another public opportunity to speak after we discuss the issues that we have on our agenda for today.
Okay.
There's two different public open sessions.
Okay.
So this one is you have any questions on the agenda as the agenda is stated, but we won't be discussing anything until after that first public session. So you might want to just ask for the second public session.
Sounds good. Thank you.
Okay. Is there anyone else?
Hi, my name is Teresa Brady.
Okay, Lisa, do you want to speak before we speak on the agenda?
My name is Teresa.
Teresa.
Okay.
Teresa, what municipality are you calling from?
Frankfurt. I'm in Augusta.
Frankfurt. Okay. Are there any other callers that wish to speak?
Yes, I would.
Your name, sir, and the municipality.
David Dewitt, Hampton Township.
Okay, David.
We have 3 callers so far. Is there anyone else before we start this session?
I'm sorry, I joined late. Which public session is this?
This is the first public session relating to agenda.
Okay, I would.
And your name and municipality, please.
Linda Gianni, Andover Township.
All righty, we have four callers for this public session. I will call Mr. Matthew Cable from Freedom. Mr. Cable, you have 3 minutes. You can start now.
Okay, thank you. I just had briefly a few questions for the local officials about the crisis at the Andover Subacute Care Center. So my first question is, on what date did you receive the first call from family or staff that something was amiss at this facility, and who did you reach out to at that time? My other question was, on what date was the call for PPE made to the Office of Emergency Management? Thank you very much.
Okay, those questions are going to be a part of the presentation, Matthew. Would you mind if we give our presentation first, and then if you have any questions about that, we have another public session that you could speak on it?
Oh, my apologies.
No, that's okay. That's okay. Let me just say something for everyone on this call. It is very difficult to have a conference call and try to explain how all of this works when you're not present. So no apologies. We're all trying to work through this. We're just very grateful that you're here, and we want to hear everything that you have to say. So you can speak at this public session, or you can speak at the next one. It doesn't matter. But we'll be answering all of those questions for you as we go on.
Okay, I guess I'd like to speak at this public session once the time is appropriate.
Well, you can speak right now.
Oh yeah, that was all I had to say was those questions.
Oh, okay. Okay, then you can speak again after we speak and give the presentation. You might have more questions.
Okay, thank you.
Thank you, Matthew, very much.
Our next caller is Teresa Brady from Frankfurt.
Hi, yes. I will sit and wait for the public session to take place, and then I will ask any questions if they have not been answered. But I'd like to say that I have a family member in Subacute too, And the last time I saw that person and spoke to that person, my brother-in-law, was on March 9th. And at that point, we were never told anything was even happening in the facility. But I will wait for the public session, and I will hear any questions if that's possible.
Thank you.
Our next caller is David Dewitt from Hampton. Mr. Dewitt.
Yes, hello. I have read what I could about this issue, and I would like to move forward and not engage in Democratic or Republican finger-pointing about who's to blame for what. I found Ms. Fantasia's comments to be somewhat hyper-partisan, and I certainly hope your discussion of this issue and your solutions to our problems here in Sussex County can be resolved without any of that. And that's pretty much what I have to say. Thank you.
Thank you very much.
Our next caller is, our last caller, is Linda Gianni from Andover Township.
I'm going to reserve my right to wait until the next public session. It's also about the Andover Subacute. So I'll wait for your presentation.
Okay, thank you.
Mm-hmm.
All right, is there anyone else that wants to speak that we missed?
May I say something, please?
Your name and municipality, please.
I'm Ellen Klein, and I live in Ocean Township in New Jersey, but have a sister in Andover Subacute. I would like to possibly comment after the presentation is given.
Absolutely. That'd be fine.
Thank you, ma'am.
Okay, not hearing anyone else, could I please have a motion to close the public session?
So moved. Anthony.
The second?
Second. Hertzberg.
Any discussion? All in favor, please signify by saying aye.
Aye. Aye.
Thank you. Right now we're moving into freeholder comments, and this is where we will be discussing the Andover Subacute facility, and I will begin. On March 29th, the Sussex County Division of Health was informed of the first confirmed COVID-19 case in the Andover Subacute Rehabilitation Center. That sparked immediate concern about the health and well-being of all the residents and staff in that facility. Family members began to call the county with disturbing stories about the lack of resources, deplorable conditions within the facility, and the neglectful treatment of their loved ones. Anonymous calls from employees echoed the same complaints and apprehension for residents and for themselves. The staff was on overload, exhausted, and scared. Since March 29th, when the Sussex County Division of Health first heard that there was a confirmed case in Building 2, they have been in constant contact with the New Jersey State Department of Health, sounding the alarm and asking for an immediate response. There have been discussions that have reached the governor's office about deploying the National Guard, but nothing ever materialized. The New Jersey State Department of Health brought in a survey team, and the facility is presently operating pursuant to the state's directed plan of correction. However, there have been no indications that the conditions within the facility have improved. The state's slow response and lack of communication is what prompted Freeholder Anthony Fasano's request that the Board of Chosen Freeholders take formal action. Thus, today, we consider asking Governor Murphy to activate the National Guard on behalf of our most vulnerable and precious residents in Andover. Within that facility, there are people who still need immediate assistance, questions that still need to be answered, and urgent actions that still need to be taken. At this time, I would like to ask Freeholder Anthony Fasano to please read his request into the official record.
Thank you, Director Patillo. Thank you, Director Patillo, and thank you to all who have joined us today. And as the Director stated, this special meeting has been called because of the ongoing health crisis at Andover Subacute and Rehabilitation Center and the need for Sussex County's highest governing body to urgently and formally ask the Governor of the State of New Jersey to provide a more substantial response to effectively combat it immediately. After I was given another frustrating briefing last week by the Sussex County Division of Health regarding the Andover facility, I wrote the following request to my Freeholder colleagues on April 29th, 2020, titled Andover's Most Vulnerable Need Immediate Activation of the National Guard. I will now read that statement into the record. As the liaison to the Sussex County Division of Health, I have been regularly briefed of the tragic health crisis at Andover Subacute and Rehabilitation Center and the division's work with the New Jersey Department of Health and Andover staff in striving to prevent needless loss of life and the spread of COVID-19 in this facility. The New Jersey Department of Health is the entity directly responsible for monitoring, inspecting, and investigating this privately owned, state-licensed, long-term care facility within Sussex County that is currently home to hundreds of some of our most vulnerable residents. As outlined below, the county has exhausted all of its feasible options, and I am deeply concerned that the state of New Jersey is not doing enough to address this ongoing health crisis within the Andover Subacute and Rehabilitation Center. The Sussex County Division of Health has corresponded with state officials more than 30 times over the last 30 days regarding this facility. They've also filed complaints with the New Jersey Department of Health and alerted state officials of whistleblower complaints by facility residents, staff, and/or family members. The Sussex County Division of Health has spoken with the State Ombudsman's Office and has advised the Sussex County Prosecutor of allegations, which were ultimately acted upon by the Andover Township Police Department. The Sussex County Sheriff's Office of Emergency Management has delivered approximately 30,000 items of personal protective equipment to this facility as well. Sussex County has followed all New Jersey Department of Health procedures and guidelines while alerting state and federal officials about critical needs within this facility that required urgent, immediate action. There is nothing that indicates to me that this is still not the case today. The state of New Jersey has acknowledged its role in this crisis and has taken some steps to remediate. The New Jersey Department of Health has prohibited this facility from admitting new patients and has ordered the facility to retain an infection control expert along with other key consultants. The county is also aware of reports that the state has sent survey teams and has requested corrective action from this facility. Despite consistent alerts from county officials to state officials, clearly expressing the urgency and magnitude of this crisis, it has been met with a state response that has been insufficient in resolving it. There are residents in this facility who cannot speak for themselves and need urgent assistance. There are lives on the line as we are running out of time and options. Because of this, I am asking the Freeholder Board to formally request the assistance of the National Guard to provide critical protocols, staffing, and resources to the Andover Subacute and Rehabilitation Center. Signed, Anthony J. Fasano, Sussex County Freeholder. That was a statement I submitted to the Freeholder Board last week, and this is still a serious matter that still lacks a serious state response to resolve it, and that is why we are here. We are currently reporting the Andover facility to have 169 residents and 55 staff members that are confirmed positive for COVID-19. A total of 110 residents have sadly passed away at this facility since April 2nd, with 68 of those deaths being confirmed to be COVID-19 related. I was encouraged to learn over the weekend that the State Commissioner of Health said that she would be asking for the National Guard to help in long-term care facilities throughout the state. However, it is clear that the Andover facility needs more than just bolstering, and Sussex County has been urgently expressing that to the state for too long. Yesterday, Sussex County again reported to state officials the reports of bedding not being washed and residents not being regularly changed from their clothing. Not all residents in this facility can speak for themselves. We too often have heard from families of these residents and staff in this facility. And frankly, enough is enough. I stand with my Freeholder colleagues today to request the formal assistance of the National Guard to provide relief for Andover's most vulnerable who urgently need it right now. Thank you, Freeholder Director Patillo, for allowing me to have the floor, and thank you to my Freeholder colleagues for your time, work, and consideration of this urgent request. Thank you so much.
If he doesn't want to change his clothes, we can't make him.
Before we go on, could you please put your phones on mute if you are not speaking? It would be helpful for all of us. Thank you. Thank you very much, Anthony. Next for comments is Freeholder Herb Yardley.
Thank you, Sylvia. I also have something to read. Do you want me to save my letter for later on?
Yeah, save your letter for afterwards, yes.
Okay. On this issue, I'm very disturbed by the fact that we find in the newspaper that the state implemented a remediation plan, yet we have no copy. We are not notified when inspections are made. We are not notified when corrective action is made. We are not notified when complaints are filed against the facility. We are not notified when fines and penalties are filed against the facility, and we do not know when there's been compliance or remediation or just a penalty. We do not have access to the residents, records of the residents. We don't know what their plan is, and there are certain plans that are required by federal law. Don't know whether they have been enacted. So what I did was I did ask county council to please Oprah all of this information so that we are able to get it. I find it unfortunate that the state health department does not send us that information as routine. I'm going to ask Kevin if he could just give you a little bit of an update on some of the information that he has Oprah'd. And then Kevin, you can let everyone know whether your documents are at this point, whether we can give copies of that out, what we're looking for.
Yes.
Turn it over to Kevin.
Oh, okay, here.
Thanks, Herb. I just want to indicate for the record that at the direction of the board, I did prepare and submit a total of 19 Oprah requests and filed them with the State Department of Health last week. They include the items that Herb mentioned, of course, the inspection reports, complaints received, particularly the plan of correction that we understand is being implemented. Our Department of Health did request that report, and the request was denied. We asked for copies of applications, licenses, penalties, and again, all the inventories and all the reports submitted. As a matter of fact, in terms of the inspection reports, if you go to the State Department of Health website, they refer to the inspection reports, but they tell you that you have to Oprah them. You can't get them any other way. So that request is pending. The state has 7 days in which to respond. That 7 days will be up, I think, Friday. So we're waiting for information that, again, should be available to us and the public, and we'll have to wait for that reply. Thanks.
Herb, is there anything else?
I just wanted to say that if you go to the Medicare site, you can get a look at one inspection. And the question that I am looking for, and I think the board wants to have with these Oprahs, is that how many inspections were actually done? And what did those state inspectors find? And I think that information needs to be, we need to get that, and we need to make sure that information is handed out to the public. That's all. Thank you very much, Sylvia.
Okay, thank you very much for that report. Next is Freeholder Josh Hertzberg.
Thank you, Freeholder Director. As some of you know, this has been a subject that has become very close to me. First, having close friends with family there, and then getting to know others with family there personally and hearing their pain and their struggles. We have been extremely vocal with our disappointment in the state's response to this situation. And I do understand that everyone's resources are stretched thin and that we are all trying to do our best in most cases during this situation. But I cannot in good conscience say that I see that here. I can't in good conscience say that I see the people responsible for helping these patients and workers at Andover Subacute facility doing their best. I'm appalled at the ownership. I'm disappointed in the state's lackluster response. This is quite literally a life and death situation, and nobody is treating it that way. Well, I can promise you that we are going to treat it that way. We are going to hold those to blame responsible. I have no faith that the state has the will, the resources, or the skills to properly address the situation. Because there's been a lot of talk and very little action, we are now looking into our own investigation of the Andover facility. First and foremost is getting the help they need in there now for the patients and for the workers. But we will be exploring the possibility of a task force. We will be exploring our options and should have more information at our next meeting. It would be easy for us to say that it's not our jurisdiction, let the state take the lead, it's their job. But I think I speak for all the freeholders when I say that as long as they're Sussex County residents, we will not allow the system to continue to fail them. I don't care who these people are or what high-powered attorneys they have or what clout their political contributions have bought them. They don't scare us, and they will not dampen our resolve to advocate for our residents, whether they can speak for themselves or whether they cannot. That's all I have, Sylvia. Thank you.
Thank you very much, Josh. Next is Deputy Director Dawn Fantasia.
Thank you, Sylvia. I appreciate it. There are two areas today that I would like to address. I want to go over the numbers and percentages regarding our report for cases and deaths in long-term care facilities in the county and specifically at Andover Subacute 1 and 2, and then also the communications timeline and some of the contents of that timeline that have gone on between county and local agencies and the state of New Jersey and the facility. So first, I want to preface this by saying that Anthony Fasano had provided numbers up to date as of today. The reports that I'm pulling are comprehensive. They are as of April 30th. They run from the first of the year, from the inception of this calendar year through April 30th. So at that time, and that's our most recent weekly report, if you recall, every Friday we release a weekly report of these numbers, and moving forward we'll do the same. So as of April 30th, there were 948 confirmed cases of COVID-19 in Sussex County, with 322 of those attributed to long-term care facilities, so that's 34%. At that time, there were also 114 deaths of county residents reported, and 85 deaths in total, which is comprised of 82 residents and 3 staff members of long-term care facilities, account for 75% of the deaths that are reported in Sussex County. Now, Andover Subacute 1 and 2, I'm running it on the numbers of 66 individuals, accounted for 66 individuals, or 58% of the deaths in Sussex County are attributed to that facility. So I just wanted to clarify those numbers for the public. Now that takes me to the timeline for Andover Subacute. So the freeholders had requested that we received a clear timeline from the Department of Health. So it is any and all communication from starting the 5th of March is the first entry, and this report runs through April the 27th. So the first contact had happened relating to COVID-19 on the 5th of March from our public health nursing to Andover Subacute, which was providing pre-outbreak directives per the New Jersey Department of Department of Health. So that information comes to public health nursing, and then they distribute and disseminate the information directly. Then our first reported case to the New Jersey Department of Health epidemiologist was reported from Andover Subacute 2 by public health nursing, and it was to inform them of a COVID outbreak. Now, this sheet here has we're at 114 entries in this sheet. What I can say is this timeline reads like a nightmare. It increases in intensity, and it reaches a clear breaking point. Beginning April 1st, Andover Subacute began sending daily, Monday through Saturday, with the exception of Sunday, COVID patient and staff information directly to the New Jersey Department of Health each day, 6 days a week, with a CC to our public health nursing. So on April 8th, I would like to note that the county reached out requesting a staffing update to inquire whether or not adequate staffing was present based upon the increases in cases. Again, on April the 9th, we have Carol Novrit from the county calling with a complaint from a staff member who worked at Andover Subacute that residents were not being fed and that, again, there were staffing issues. The Department of Health, the New Jersey Department of Health replied, please contact the New Jersey Department of Health Facilities complaint line. Calling that number resulted multiple times on multiple accounts as the mailbox was full. So it was frequently not allowing messages to be left because the mailbox was full. On April 12th, we have a request for update on the inspection, confirmation of any bodies that were on hold, questions about PPE deliveries, information about funeral homes who were removing those deceased. The Office of Emergency Management was working with Atlantic Health to reserve space in a refrigerated trailer if needed, and guidance from the New Jersey Department of Health to long-term care facilities with a review coming in the week. Now, I want to backtrack for a moment on the question that the gentleman had first asked. I can say that on April the 1st, 250 masks were delivered. It was a combination of N95 and surgical masks to the Andover facility. And then they increased in frequency of deliveries and size of deliveries to date, with over 4,000 N95 masks and 15,000 surgical masks and over 10,000 pairs of gloves, 66 bottles of hand sanitizer up to this point. Now, on the 8th of April, we have Andover Subacute being provided the number again to call for PPE requests directly to our Office of Emergency Management to ensure that they had adequate PPE. Now, the timeline highlights multiple calls from Andover Subacute staff, from family members, from officials from the County of Sussex, from the Office of Senator Oraho, and the Office of Congressman Gottheimer for staff allegations of patient abuse, requesting stats and information of how many were infected, and we have no less than 8 boxes in this spreadsheet that assert a lack of response from the New Jersey Department of Health. On the 14th of April, we received word that there would be an emergency curtailment of new admissions. As the list goes on, after the incident where Andover local police were involved, visiting the facility over Easter weekend, we also see a continuation and an increase in reports from staff members and family members who are contacting the county or contacting Andover Subacute or contacting Senator Orojo's office or contacting Congressman Gottheimer's office, asking for assistance with the situation and citing a lack of response from the New Jersey Department of Health. So this barrage of calls and contacts from various agencies, various elected officials, various family members leave us with significant concerns, as you can imagine. So yesterday in the daily update from the governor's office, we have here that investigators are seeking evidence that administrators of long-term care facilities cut corners, ignored red flags or warnings, or lied to regulators or others, as our Attorney General Gruhl stated, and I quote, to put profits over patients, was what was stated yesterday. So there is a new reporting platform at covid19.nj.gov/LTC. Tipsters can remain anonymous, but they must have firsthand knowledge of potentially illegal actions. And at that portal, you can submit photos, documents, and any other materials. So the Attorney General did state for many of these facilities, this was the equivalent of a 500-year flood. But that doesn't mean we shouldn't examine how folks responded when those floodwaters started rising. And it also doesn't mean we shouldn't examine how they operated before the flood. So that is the direct quote from the Attorney General. So the state now appears to be taking steps towards greater accountability, and nobody discounts the magnitude of this health crisis. I can say this facility was well aware that this could quite feasibly happen due to staffing, as was the state. Long-term care facilities are a serious issue. We had to look no further than the lessons from Washington State when this first broke in the United States in any significant measurable numbers. I think it's very, very important that we do enlist the assistance of the National Guard. I know our neighbors in Pennsylvania have activated theirs, and they have sent 18 medical professionals to a nursing home to assist exactly because of lack of staffing. My other concern relates to Kevin Kelly as he gave his report. If we are to work together, how can a local Department of Health request a remediation report and be declined? This is not the type of working together or partnership or, working in unity for the best interest of the residents who are in fact victims in this situation. If the state of New Jersey needs information from the county in any capacity, in any way, shape, or form, mode, method, the county is more than happy to deliver it and deliver it yesterday. Whatever they need to save people that we have, every resource we have is available. But I have very, very serious concerns when it seems that red tape is preventing us from being able to act or assist. I don't understand it. How can we respond? How can local authorities respond when called for even a smaller issue? How can we respond if we are not even aware of content of a remediation report that's ordered by the state? It's baffling to me. And we have to get on the same page. This is not Sussex County against the New Jersey Department of Health. This is Department of Health working together in order to save these residents. Every day we get these reports. Every day I post the reports, and every day I hold my breath and say, why? Why are there more deaths on this report? Why? It's not acceptable. And I expect nothing less than cooperation, and I expect to give nothing less than cooperation. And thank you.
Thank you very much, Dawn. Next, we're going to hear comments from Mayor Michael Lenz Ak from Andover Township.
Thank you, Sylvia. I can hear the frustration in everybody's voice, and welcome to our world here in Andover Township. We've been fighting this for, going back to April 12th, when our OEM office went into the facility on notification of the bodies being there. They went in with two county nurses together and did a full report. The report was not glowing, did point out numerous inconsistencies, lack of PPE, lack of education, just some cross-contamination going on. So we, of course, did submit that report, and it was submitted to the state as well. To the best of my knowledge, everything really hit the fan after that when the news coverage started around the 16th, 17th, with the state coming in probably around the 19th, 20th into the facility. Last week, I was disappointed to hear that they were claiming that they had just shut it down to new patients as of that Monday. Now, I would also like to know whether that is the full facility, both 1 and 2, or just 2, because my concern is that if they shut down 2, Subacute 2, and you still have the capability to send in Medicaid patients into 1, they can easily be transferred over to 2. But more importantly, we're also starting to see a rise in cases and in deaths at Subacute 1. So obviously the problem has migrated across the street now. The numbers are, statistically are not good. When you compare it to, we have another facility, Bristol Glen, in our town, which I'm told only had 1 positive and no deaths. So my concern is that the state should be looking at what did Bristol Glen do right and what did the Subacute do wrong. According to our OEM manager, Chief Danielson, I spoke to yesterday, getting ready for this call, the pandemic virus outbreak emergency plan at the Subacute is woefully lacking, as opposed to other facilities that have full plans in place, and it's obviously showed in the numbers. Everybody's got to remember, this is a $48 million a year company that is operating, putting people's lives at risk, and I equate their deaths specifically to the fact that they did not have the PPEs in place ready. They did not have the education, the training. They did not quarantine properly. There was commingling of patients. Just have a couple notes here. I'm concerned about not hearing the state's report. When I spoke with Congressman Gottheimer, he expressed to me his concern that even when he asked to see the report, the state told him that there was a 14-day wait in order for him to be able to see the report, because it did give the owner the capability to respond. My question is, how many people passed away in that 14-day time period? This requires immediate attention, requires immediate action. Calling on the National Guard to get in there, I think, is very appropriate, and we need to get as much help in there as possible. What I would like to see done is, you can't transport all those people out. Where do you put them? I mean, the logistics just aren't there. So my thing would be to go in there, sanitize the facility, designate a wing, a unit as the COVID, anybody positive be put into that wing, segregate, and have the proper PPEs, the proper training, the staffing, and the ability to segregate the patients amongst those who are positive and those who are not. And then definitely a full investigation as to why these, it's more disturbing when I hear the PPEs were being put into the place and still hearing reports from the staff there that the PPEs are not as available as they should be, especially after hearing the county brought in 33,000. You know, where are they? Why weren't they distributed and being utilized as they should be? So I want to thank the freeholders for taking this up. You know, the floodwaters, I hate to say it, are still here. They haven't receded. So the Attorney General really does need to get on this as soon as possible. We are the largest long-term care facility in the state, which means we should be getting the most attention from the state and the most help, because this is where the largest population of the people are in long-term care facility. And, you know, we need to get this done. So I think open communication is first and foremost. Everybody should be known, because maybe somebody might have a good idea. You know, somebody who's in the process knows it. And once again, thank you very much. I hear the frustration in all your voices. And like I say, it's been a very frustrating time for the town. Our residents have suffered because of this, the notoriety of the town, and even people who have worked in that facility were residents of our town who have passed away. So this needs to be taken care of. And once again, thank you very much. Anything I can do, please do not hesitate to let us know. Thank you.
Mayor, thank you for being with us this afternoon, and we all greatly appreciate all that you have done, your council, your chief of police, and your whole police department, and all of your first responders. Greatly appreciate all you've done. It is important to know that Governor Murphy has already dispatched the National Guard into the state veterans' homes in Edison and Paramus, as an increasing number of staff members are ill and unable to come to work. The staffing crisis is affecting many of the long-term care facilities across the state. Especially hard hit is the subacute rehabilitation buildings 1 and 2 in Andover. States across our nation are dispatching the National Guard into nursing homes that have been infected with the coronavirus. The guardsmen and guardswomen assist the elderly care facilities through staff training, implementation of infectious disease control measures, sanitizing the facility, janitorial services, increased testing, providing food and care to the residents, and adopting new infection control protocols. The list goes on, depending on the needs of each individual nursing home. Multiple state governments of Georgia, Florida, Oklahoma, Colorado, Massachusetts, New York, Washington, and Virginia have successfully supplemented existing staff by activating the National Guard. Many of these states acted in the early stages of the outbreak, and their immediate response resulted in containing the COVID-19 virus and saving lives of our most vulnerable and precious population. So you see, our request to the governor is not something out of the ordinary. Since the National Guard is already on a wartime footing in New Jersey, it is reasonable and necessary to dispatch them so their critical skills can be used to help support the staff in fighting the COVID-19 crisis in Andover. Now I will read the letter to the governor for the board's consideration. Dear Governor Murphy, New Jersey is one of 18 states to deploy the National Guard to combat the coronavirus in our state's veterans' homes. We are pleased and supportive of Health Commissioner Persicelli's May 2nd, 2020 request to the state and federal branches of the National Guard to extend this assistance to our state's nursing homes. The Sussex County Board of Chosen Freeholders also requests the immediate deployment of the National Guard to provide emergent assistance at the above facilities in Andover Township in Sussex County, as initially recommended to us by Freeholder Anthony J. Fasano on April 29, 2020. A copy of Freeholder Fasano's letter is attached. It provides complete details with respect to the county's efforts to address the devastating conditions at these facilities with the New Jersey Department of Health since March. Further delay in addressing these conditions is unconscionable. Together, these facilities constitute the largest long-term care facility in the state with a combined total of 702 beds. As of May 5th, 2020, they have experienced 68 deaths, including 2 staff members, and 224 COVID-19 illnesses that are confirmed, which includes 55 staff members. The facilities are presently operating pursuant to a New Jersey Department of Health directed plan of correction. The National Guard is being used across the United States in long-term care facilities to mitigate the spread of COVID-19. They have the capability to feed and care for residents, disinfect and deep clean nursing homes that have major outbreaks of the coronavirus, provide janitorial services, audit sanitation methods, implement infectious disease control measures, and provide testing and training to halt the spread of the virus. The National Guard's resources would support the personnel on the front lines and collaborate to develop proper protocols and procedures to follow. The Freeholder Board requests the immediate activation of the National Guard in the Andover long-term care facility to prevent the devastating loss of life and spread of the coronavirus. Our most vulnerable and precious residents are crying out to us for help because we are their last hope. Governor Murphy, we urge you to deploy the National Guard on their behalf. Thank you for your consideration. Respectively, Sylvia Patillo, Freeholder Director, Dawn Fantasia, Freeholder Deputy Director, Anthony Fasano, Freeholder Member, Joshua Hertzberg, Freeholder Member, and Herb Yardley, Freeholder Member. Copies will be sent to Commissioner Judith M. Persicelli, the Honorable Mike Pence, the Honorable Josh Gottenheimer, the Honorable Michael Sherrill, the Honorable Stephen Orho, the Honorable Parker Space, the Honorable Howard Wirth, Sheriff Mike Strada, Mark Rosick, Director of Communications, Sussex County Sheriff's Communications Center, Mayor Mike Lenz Ak, Chief Eric C. Danielson, which is also Andover Township Police Department, Gregory Puff, County Administrator, Kevin Kelly, County Counsel, Carol Novitt, the Administrator for our Department of Health and Human Services, and James McDonald, our Division Director and Health Officer at the Department of Health and Human Services. At this time, I would like a motion to approve this letter and send it to the Governor, copies being sent to all that I just mentioned.
So moved, Josh Hertzberg.
And second?
Herb Yardley, second.
Is there any discussion? Terry, can I have a roll call, please?
Freeholder Fantasia?
Yes.
Freeholder Fasano?
Yes.
Freeholder Hertzberg?
Yes.
Freeholder Director Patillo?
Yes.
Freeholder Yardley?
Yes.
Okay, it is passed, and it will be sent to the Governor and everyone that we copied. Thank you so much for all that you've been doing and all the work that's been going on behind the scenes that you never even mentioned that I know that you're involved in. And thank you to our mayor from Andover for being on this call and for all that your township is doing. We're going to finish our business, and then I'm going to open up to the public so that the public can speak. So at this time, I'm going down to our administrative report. Greg Pop, are you on?
Yes, I am. Thank you, Freeholder Director. I'm pleased to report, as had been announced last week, that we are looking forward to opening up our own COVID-19 patient testing site at the Sussex County Community College. We anticipate that the site will be open to the public on Monday, weather permitting. We anticipate opening registrations, which will be available through the county's website tomorrow, May 7th. The drive-through testing site will be located at the community college. Residents will need to use the Plotts Road entrance in order to access the site. Testing will be available on Mondays, Wednesdays, and Fridays beginning at 9 a.m., weather permitting. Residents must show up in a vehicle and must have an appointment in order to access the testing site. The site is not available or set up to accommodate walkthroughs. Residents will need to display identification and will need to have a printed copy of a COVID-19 medical prescription from a medical provider. Only residents who have a prescription from a medical doctor or medical provider and who have pre-scheduled an appointment for testing through the county's COVID-19 appointment portal will be allowed to enter the testing site. We will have all of this information available shortly on the county's website. I would like to thank the members of the Division of Health, particularly our Medical Reserve Corps Coordinator, Julia Gorell, our Public Health Nurse, Kayla Shelley, and our Health Officer, Jim McDonald, for their technical assistance in setting up the site. I would also like to acknowledge Sheriff Strada and the Office of Emergency Management for providing much of the logistical support needed to stand this up. And that concludes my report. Thank you.
Thank you very much. I'm just going to call on freeholders in case you would like to make a comment about the site being opened, and I'll begin with freeholder Anthony Pisano.
Thank you, Sylvia. And very briefly, that is welcome news. By Greg, our battle against COVID-19 is about to be bolstered with this addition of a drive-through testing center in Sussex County. And this would absolutely not have been possible without the tremendous work of the sheriff, his Office of Emergency Management, our Division of Health, our county administrator, Greg, and your team, our Senator Warho, and the County of Morris, along with all of our partners and our employees and our volunteers who have been working hard to make this possible. So I'm very grateful for your work. Testing will be an important tool in our efforts to defeat this virus, and I'm very thankful to see it come to fruition shortly. So thank you all.
Thank you, Anthony. Freeholder Herb Yarley.
I think this is a wonderful event. I look forward to it opening and testing our residents. I think that this is the way that we will be able to really track with the COVID-19 virus, and I look forward to any people being tested. And they've done a great job through a lot of difficult situations just to get here. So congratulations to the administration, health department, sheriff, OEM, and all of the people that made this possible.
Thank you. Freeholder Josh Hertzberg.
Yes, thanks, Sylvia. I just want to let people know that, most counties that were able to stand up testing centers very quickly was because they had strong partnerships with a local hospital. Unfortunately for us, because of the size of Morris County, Atlantic Health allocated the majority of their resources there, leaving us scrambling and trying to find the necessary resources. Thankfully, our county administrator, working with the OEM, was able to partner with Morris County to allow us to direct our residents to their already operating testing center. We are thankful for their work and for our partnership with Morris County. Special thanks to their administrator and the Morris County Freeholder Board for that. Once their testing center slowed down, Atlantic Health reallocated resources back to Sussex County and was able to promise us some of those resources to finally allow us to get our own testing center up and running. Although there's still a concern that the state is trying to pull resources for some other stuff, we continue to hope that our partners at Newton Medical Center will be there for us so we can continue to keep up our testing for our residents. So, and a special thanks again to County Administrator Greg Poff, to Sheriff Strada and his team at the OEM, and all the health departments work. And I think it's nothing. It's not a minor task to stand something like this up, and especially when everybody in the state and in the country are scrambling for resources. It was a lot of work, and a lot of appreciation goes their way. Thank you.
Thank you very much. Deputy Director Dawn Fantasia.
Thank you. Again, to echo everybody else, yesterday I had the opportunity to go on WSUS and speak with Steve Andrews about what we were doing, how we were opening up, how it was operating. I know the residents are very eager for more details about how to register, so those details are forthcoming. And again, to thank our OEM, to thank Greg Poff, to thank our health department, to also thank, at the time, one of the very first pieces that we looked to put together before we even partnered with Morris County was ensuring that we had the proper amount of tests themselves and the proper amount of PPE, and that is where our state representatives came into play and our federal representatives. And I know both Senator Orho and Congressman Gottheimer were put inquiries for us to try to secure PPE through any channels, and it was very good news, coming from federal government. I know Governor Murphy had announced that the federal government and the president had put aside funds for that for us, and I think that that's very instrumental in making sure that some of the more rural areas that the flow of COVID was concentrated at the start, and obviously we know Bergen County was ground zero in the state of New Jersey for the COVID spread, but now so that these resources make it out to our rural counties. So we're grateful for that. It was an all hands on deck approach that seemed to work. But again, I can't stress enough the different pieces that were involved. A special thank you to Sussex County Community College for the offer right out of the gate to use their facility, use their parking lot. I appreciate that. And somebody is not on mute. It sounds like some member of the public. If you could please mute. And again, to also take into consideration that you must have a partnering agency and have enough health staff. I know some members of the medical corps have been helping the volunteers around the state of New Jersey. So again, there were different health agencies that we sought to partner with, and it seems resources of staffing were just so slim and not available to Sussex County. And to be honest, I was a bit surprised just in the aspect where, Atlantic Health is very, very large, and I'm so happy now that they were able to come and deliver for our county. But, I would hope that when we, at the end of this, and we kind of powwow and debrief about what went right and what went wrong and how we can improve in the future, that we actually do talk about the fact that it seems in so many ways that Sussex County is a bit of an outlier in some of the resources that we get. And I see a trend there, and that's a disturbing trend. So, again, grateful now, but I think we have to take a lot of these lessons learned, because the public is 100% correct in asking for a center in the county that's accessible to residents so they're not driving an hour. As much as, like I said, it's wonderful that it was available to us, and we're grateful for it. I shared in that level of frustration from them in order for us to establish this partnership. So we look forward to serving the public, with our soft opening. Thank you.
Thank you, Dawn. Greg, I would just like to let the public know that trying to collaborate with a healthcare provider was extremely difficult because we couldn't get there were so many limited resources with the PPE and the other gear that was needed that we couldn't get it. There were often times that you were just about to sign a contract and the provider pulled out. So we do celebrate that you were able to do this. I know it took a lot of time, a lot of perseverance, but you were committed to this. And am I correct in saying that the Morris County testing site will be open as well?
That is correct. We will continue our relationship with Morris County so as to ensure that we have the maximum capability of being able to test Sussex County residents, And so residents will be able to register both on our county website and also have instructions for being able to access the County College of Morris site in Randolph so that we can ensure that we have the greatest capability of being able to serve our residents.
Okay, thank you so very much. Good news. Right now I'm going to move to new business, and I believe that Freeholder Herb Yardley. Yes?
Oh, go ahead. Sorry.
I just want to introduce Herb that you have a letter that you wrote to the governor that you would like to read into the official record right now.
Yes, thank you very much. Once again, we find ourselves with testing on the short end of a long stick. I sent a letter to Governor Murphy, and I'll read it now into the record. Sussex County is home to 140,000 New Jersey residents. On average, 70% of our workforce commute from Sussex County to a place of employment outside the county. Most commute to and from the New York area. Our citizens are anxious to get back to work. However, we know the importance of doing this safely. As of today, our county is one of 4 counties in the state that have not received any financial aid from the state or federal government to assist in the fight against COVID-19 pandemic. On Sunday, the New Jersey Herald reported the county's death rate to be twice that of the state as a whole. Sussex County has more COVID-19 deaths than 16 states in the country. Having received no state or federal financial support, we find ourselves in a situation where we must use our county budget to pay for kits to test our citizens for COVID-19. This was not anticipated when we drafted our budget. Sussex County has been determined to be in a hot region, which is why it's critical we receive the necessary financial support to help us get through the coming weeks and months. This will provide the county the flexibility to best assess our most urgent needs. It's imperative that we keep testing our residents. Therefore, we will be using our county budget to start providing tests to our residents for COVID-19 on Friday, May 8th, which is May 11th. In order to get our residents back to work, it's crucial that we receive funding to continue to provide testing to ensure that we keep our residents safe, healthy, and to prevent a second wave of this deadly virus. The state of New Jersey has received certain non-entitlement funds through the CDBG, more than $4 million, and the ESG, more than $11 million programs. It's our understanding that you can allocate these funds at your discretion throughout the state, particularly to help struggling counties that did not directly receive relief. After your recent meeting with President Trump, the state will be getting 550,000 test kits and 750,000 swabs. This should increase the output to at least 20,000 tests a day in New Jersey. Will Sussex County be getting any of these tests for our residents? Or are we going to fund the testing entirely through local property revenues? It's my hope that you will fund the testing program you have expressed we all need in order to get our residents back to work while we also keep them safe and healthy. Thank you, Herb Yardley, Freeholder. I sent this out, I think it was 2 days ago, in order to try and get the governor to send up some funding for Sussex County, who has received no money for this program, and it's inconceivable that this could happen in New Jersey, where counties around us are getting hundreds of thousands of dollars, where Sussex County doesn't get any funding to run programs that we need. So thank you, and for giving me the opportunity to read that into the record, Sylvia.
Thank you for writing that very much, because that letter will keep these issues alive, and that's important for our community. I'm going to ask freeholders if they'd like to speak. I'll start with Anthony Fasano.
Thank you, Freeholder Director, and I know a lot has been said today. Certainly, I have said a lot, and I realize that. So I appreciate everybody taking the time to join us for this important meeting, really with this Andover facility. being the prominent focus of this emergency meeting because it's necessary. And I think you heard from all 5 freeholders today our collective frustration. Many of us have heard from families in this Andover facility. Many of us know families in this Andover facility. This is personal. Sussex County is not a particularly big county, and when dealing with a facility like this, it very much, in every sense of the word, is personal. And I think when Sussex County's government feels that its most vulnerable residents who cannot always speak for themselves are not getting what they need and what they deserve at this juncture in time, that we are not going to sit idly by. And I very much appreciate all of the work from all of our county employees regarding this Andover facility and their frustration that they have shared with me as well. And I especially appreciate the support of my freeholder colleagues because I know they understand that this is urgent as well. So thank you to all who joined us, and thank you to the freeholders for putting forth this really important, really urgent, and I think necessary request. So certainly I'm available if there's any questions regarding this, as I know we all are. So thank you very much.
Freeholder Josh Hertzberg.
Yes, I just want to, say that we've done, there was a caller before, and I think that even on our last one, talking about this being political and being Republicans against Democrats, and I personally haven't heard any of that. I've heard people asking for help. I've heard, there has been some people calling for accountability. We've actually, and I'm still going to ask for accountability, but it has nothing to do with elected officials or their political affiliations. It's government bureaucracies that have become inefficient and the processes that have been installed not working. And whether that is a county process, a state process, at this point, I don't care whose process it is. We need to identify the bad processes and fix them because the people deserve it. And I hope that nobody else is trying to make this political, because I know we certainly aren't. And all you've heard from us is frustration, as so many of us have expressed, in that when you get, the calls and the people asking for help and you have no authority to act on that, it is extremely frustrating. When you get calls from people in the facility at night asking for your help and all you can do is call other people to try and get them to do their jobs, it's extremely frustrating. And, I thank Anthony, Herb. I think all of us at one point have written letters asking for help, trying to get people to do what they're supposed to do. And now it's time to take it into our own hands. Whether we have the authority and the ability or not, we're going to do it. And so I thank my fellow freeholders. I want to thank all the people who have risked, what they consider retribution for calling us, for giving us information, for trying to make it better, and for asking for help. Keep doing it. We're here, and we're not going to forget about you. Thank you.
Thank you. Deputy Director Dawn Fantasia.
Thank you. I'm going to keep this very short because I think we've said quite enough, and I'd like to hear from the public. I would just like to specifically thank Andover, their mayor, governing body, their police department. It is not easy to be in the situation that you are in. You were constantly receiving a barrage of calls from the facility, from employees that work there, from us here at the county, and I have a lot of respect for just the professionalism and how quickly your response has always been as a local department. So I really want to specifically thank Andover Township. It's just an outstanding job. And that's all I have. Thank you.
Okay, and I'm just going to ask Mayor Michael Lenz Ak if you would like to say anything else before we go on to the open public comment.
No, thank you very much for the opportunity. Appreciate all the help, and just want to let the public know. Absolutely, this is not a political thing. This is about saving people's lives, and we're all working towards the people who don't have a voice. So we have to do this for them. So thank you, everybody. I appreciate it. And thank you for allowing me to be on the call.
All right, now we're going to go to the public session. You can speak on anything that you want to speak on. Terry, would you like to read the names that you already have listed who want to speak, and then I'll ask for anyone else that's not on that list?
That's fine, thank you. The first caller was Matthew Cable from Freedon. Second caller was Teresa Brady, Frankfurt. Third, David Dewitt from Hampton. Fourth was Linda Gianni, which I do not have a municipality identified. So, Ms. Gianni, when you do speak, please identify your municipality. And the next one is Ellen Klein from Ocean Township.
Okay. Now, I know there was an Abby. If there's anybody else out there that wants to be heard at this open public session, could you just give us your name and your municipality?
Yes, hi. Could you add me in?
I'm sorry, could you repeat your name?
Sure. Almir Osmanovic, Hamburg.
Next. Levin, Hardiston.
I'm sorry, you have to speak a little louder and a little slower. What was your name?
I'm sorry. I'm sorry. Christy Levin, Hardiston.
Is there anyone else?
Yes.
Yes.
Hello?
Yes. Your name?
Hi, my first name is Karen, Caren, and my last name is Matzner, M as in Mary, Atzner.
And where are you from?
Municipality?
I live in Hoboken, Hoboken, and I have a relative in Andover too.
Okay, thank you. Is there anyone else?
Yes, Katie Rotundi, Hampton Township.
There's some useless.
Is there anyone else?
Whoever, excuse me, I need to, there's somebody I think sounds like kitchen background noise with a sink running. You need to mute your phone. I'm sorry, Ms. Rotundi, what was the municipality?
Hampton Township.
Thank you.
Christine Dunbar, Sparta Township.
Is there anyone else? Okay, not hearing anyone. Can I have a motion to open up to the public session, please?
So moved, Anthony.
Okay, thank you, Anthony.
Second.
Can I have a second?
Fantasia. Second, Dawn Fantasia.
Is there any discussion? Not hearing any. All in favor, please signify by saying aye.
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 Okay, we are open. And Terry, would you please call the list?
Yes, just bear with me 1 second. Callers, I just want to remind you that you will have 3 minutes. I will give you a 1-minute warning. We will stick to this timetable and move on to the next caller. So our first caller is Matt Cable from Freedon.
Yeah, hi. There were just a few details from the presentation that I wanted to clear up since there's a lot of information. So my first question was, on what specific date was the first call from whistleblowers at Andover Subacute or from family members to local county officials, and who took that first call? And then my other question was, on what date did local officials first reach out to state officials? Thank you very much.
All right. Wow, how many?
Okay, I can pull that information from the report. So your second question, I believe I can answer first because it's right here. Your second question is, what was the first date that the county made contact to Andover Subacute or made contact to the state of New Jersey?
To the state of New Jersey.
That first report was on 3/29.
March 29th. Okay.
March 29th was the first contact. And then as far as receiving information from individuals inside the facility, I have here, just bear with me. So you're talking about a member of the public contacting.
Yes, either individuals inside the facility itself or family members of people staying at the facility.
Okay. Okay, we have a litany of contacts from public health nursing asking for clarification of issues, and it does not indicate where that came from. For instance, it says asking for staffing concerns as of the 7th of April. The first on this sheet of an actual son of a patient inside of the facility. We have, let me see here, the 9th, the son of a patient contacted public health nursing on the 9th. And let me see if I can just pull one more.
I'm sorry, the 9th of which month?
April.
April
I have
9th.
April 9th,
Okay.
a call coming from the son of a patient. That's specifically what you're looking for someone within the facility or an individual, an employee. That's what I have on this. Now, again, like I said, there are a significant amount of public health nursing contacts here where they contacted either Andover Subacute or contacted the New Jersey Department of Health asking for clarification and guidance, but I'm not sure. It does not indicate on this sheet what prompted that call, whether that was self-prompted or prompted from a tip per se.
And it doesn't indicate on what date the first tip was called in or on what date the first call for clarification to county officials was.
To county officials, no. This sheet comes from the County Division of Health. So anything that came from the Division of Health, this is what they sent to us, and that encompasses public health nursing.
So Division of Health is a state level?
No. The Division of Health it's our county Division of Health, and public health nursing works in conjunction with, they're a branch of the Division of Health.
1 minute. I did give extra time.
Oh, okay.
I just want to add too, Matthew, that March 29th was the day that the county was notified of the first positive COVID case in Building 2.
Mm-hmm.
And if I can just add to that quickly to the gentleman's question about that correspondence on March 29th, specifically on March 29th, the Sussex County Division of Health reported to the New Jersey Department of Health of an outbreak or cluster of this virus within the facility. So that was the first time that Sussex County Division of Health went to the State Department of Health on March 29th to report an outbreak of COVID-19 in the Andover facility. And that really, the list that Dawn is referring to, that's really where, in essence, that starts, and that frequency of activity starts is on that marker on March 29th.
The time is up.
Okay. What I can say, if I
Our
can
next
just answer.
caller.
Terry, if I
Yes.
can just answer. On April 5th is my first personal referral of an issue from the daughter of an employee at the facility contacted me on the 5th of April, which resulted in me reporting that to Carol Novrit and at the county, who reached out to the state. So that's on my end. I can speak for me, and the first outside that I received myself and referred was the 5th of April.
Our next caller is Teresa Brady from Frankfurt. Ms. Brady?
Yes, good afternoon. First, I'd like to thank all of the freeholders, the director, and the mayor, of course, of Andover. A lot of my questions were answered with all the previous callers, but I do have a couple. Is the facility closed to all patients going in at this point to Subacute 2 and 1?
Yes.
Okay, so they're not.
We've closed that.
Okay. And where are we at now with the lack of staffing and the needs for the residents, their safety, and also cleanliness of the building? I know we're trying to get the National Guard in there, and that might take some time. And again, thank you to Freeholder Fasano for doing that. So where are we at that point? Because I'm hearing a lot of conflicting stories from people who have loved ones in there. I have a brother-in-law in there. He's been there for 20 years. The last couple of years have not been as good as the prior years because of change of ownership. So I'd like to know, where are we at this point now before we get the National Guard?
We don't know because no information is coming out of the building and nothing is coming to us from the state. So what we're getting phone calls like we were in the beginning. That's how we were finding out information is family members and staff or members, family members of staff were calling us. That's where information was coming from.
And unfortunately, my loved one is not able, so I rely on the news that comes, from our freeholders, from our newspaper, from our TV stations, from the state health department. Again, we are all concerned because we cannot.
1 minute.
Teresa, that's why we're taking this action right now, is we need to get the National Guard in there for exactly this reason. And we are opening all the requests from the state to get the information that they are not giving to us.
Yes.
But let me read something that I didn't mention to everyone. The Commissioner Persicelli at the State Press Conference on April 20th, these are the things that she put into place by the state. She said state surveyors have been out to 21 LTC facilities to inspect and assess their compliance with state and federal regulations and guidelines. Now, let me say something here. This is her statement from April 20th. Her statement from April 16th spoke about a report from her surveyors that said that the staffing was appropriate. And then she read a report from the owner that said that the staffing was solid. That was on April 16th. On April 20th, she also said, these include infection control, staffing, availability of PPE, and implementation of an outbreak response plan. So those were things she was putting in place. Directive plans of correction are due to the state this week. Andover Subacute and Rehabilitation is required to hire a consulting administrator, a consulting nurse, and an infection control professional. Nowhere does she say to hire staff. She also said they must also cease having new admissions, as well as provide a progress report by the end of the day Monday on the selection of an aforementioned positions to be approved by the NJDOH. The number of COVID cases confirmed and total number of COVID deaths can be assessed at https://covid19.nj.gov. That was her report.
Has any of that been done? Honestly,
we don't know that.
Correct.
We have not getting anything. We have asked for information. They have not given it to us, and that's why we are putting in an OPA request, which is the Open Public Records Act, that says that they have to give us that information because it is public information. They are not giving it to us. They are not giving it to Andover. They're not giving it to the Chief of Police in Andover. So it's not because we're not asking. They're not giving it to us. So let's see if they answer our OPA request.
I understand
Sylvia,
that.
can I?
We are past time.
And a while back, that city had an infectious outbreak. Unbeknownst to my family, we went in there and we were never told about what was happening, only to find out that it was running rampant in the facility. I mean, that's not how things should happen. We need to have transparency.
Well, Teresa, that's what we're trying to get, and that's why we're at this point.
I appreciate all.
Sylvia, can I add something?
Sure.
So, Teresa, one of the things I briefly mentioned, and I don't want to go into it too much until we have it put together, but we are researching the idea of putting together a task force with law enforcement capability and doing our own investigation and uncovering some of this information. We're not getting it. We're asking. No one's answering. So we're looking at just doing it ourselves and getting the answers and giving it to people who will actually do something about it.
Mm-hmm. Thank you, Josh.
I appreciate it because the facility.
Okay, our next caller is David Dewitt from Hampton. Mr. Dewitt, are you there?
Yes, I am. Can you hear me?
Yes, thank you. Please start.
Thank you. I have just a couple of points to make. First of all, I would like to thank the Freeholder Board for advocating for the people in the nursing home and the people that work there and all the citizens of Sussex County who hope to get out of this plague without further loss and damage to our friends and families. My comment about your testing regimen, the drive-in testing regimen, I think it needs to be looked at from another perspective. We do have a population in Sussex County that is unable to get in a car and drive through for a test. They're pretty much of the lower economic class. They're folks that don't have a lot of resources. They spend their days as a pedestrian in one of our towns. They may actually be folks that are here on a green card or not. I think if we miss them, we're going to not have as an effective testing program as we should have. Thank you.
Thank you very much.
Our next caller is Linda Gianni.
From Andover Township.
Thank you. Thank you.
Okay. I have four different things. I know it's a difficult time all around for everyone and people's routines are off. And I also realize that this is a special meeting. However, I'm curious as to why this meeting is in the middle of the day when so many people are working. Even though I'm working from home, I have to stop. I've been not working for an hour and a half. If I wasn't working from home, I wouldn't even be able to attend this meeting. So what is the reasoning of having it at 2 o'clock in the afternoon?
The reason was because we had our staff available. We've been having our regular meetings at 4:30 for the same reason, to have our staff available here.
Okay. I would ask that you just please be considerate of the public and their schedules.
Okay. Thank you.
And again, I realize these are unordinary times. Another suggestion for the public comments section, and I realize it's hard to conduct these meetings over the phone. You request that we give you our names ahead of time. It makes perfect sense because then you don't have people talking over each other. My suggestion might be that at the end of that list is to ask again if anybody had comments, because at the last meeting I didn't have initial comments, so I didn't give you my name. And then after hearing everybody's responses, and particularly some of the freeholders' responses to the questions, I now had a comment, but there was no other period. You didn't ask, does anybody else want to talk? So I now have comments I wanted to make 2 weeks ago. They're not quite as relevant. I realize that, but I still would be remiss if I didn't make them. And what the comments are is that I'm glad my new comments, I've edited a little since today's meeting, because I'm glad to see that the Sussex County Freeholders are stepping up to the plate, because at the last meeting, it didn't seem like you were doing that at all. At the last meeting, it seemed that you were blaming the state, and one freeholder even said that you have to do what the state says when it comes to who is in charge of the nursing home. What I find ironic about that part of the comment was just 5 months ago, when the subject of immigration and sanctuary states came up, the freeholders openly bucked the state and said they don't have to do what the state tells them to do, and that they don't have to listen to them. So there was some irony there. But I am glad to see that you are stepping up to the plate and taking some responsibility and some lead in this. And my last comment is on the testing sites. There seems to be different tests out there with different response times. The test that will be used in Sussex County, how long will it take people to get results on average?
Greg, could you answer that, please?
Yes, the testing lab that we're working with indicates 4 to 5 days, but as they have, this lab is deployed in a number of testing sites that are throughout the state. We understand that the test results typically will come back between 24 and 48 hours.
So in less than 45 days.
I said 4 to 5 days is what the laboratory agrees to in terms of their contract. But our experience at the Morris County testing site is they're typically turned around within 48 hours.
Okay. Thank you. That's it.
Thank you very much.
Okay. Our next caller is Ellen Klein from Ocean Township.
Thank you. I just wanted to start by saying I don't know any of you ladies and gentlemen who spoke, who are members of the Freeholders, but I just want to say a huge thank you. I can hear the sincerity in all of your voices and how much you're trying to do, and after dealing with people who have not done enough, I truly appreciate it on behalf of my sister who is there. I think it is obvious that some of the stuff that came out today that I've heard is greatly disturbing and what I have suspected all along. I'm very, very upset that it's still continuing, and I'm also upset, and I have written to the governor's office about the governor's office giving, and this hadn't been mentioned today, giving some kind of protection to nursing homes so that I feel if they have protection from any liability, they have no incentive to change. And if they feel nothing can happen to them, and then it puts the lives of our loved ones at great risk. So I'm very worried about that. I don't believe in frivolous lawsuits or anything of the kind. I'm not implying anybody should be doing that. I'm simply saying I want to make sure that, and I appreciate you're going to do everything you can with the National Guard, because I just feel like even with all the scrutiny that's on them, it's still coming out that there's still things going on that are risking people's lives, and there's not adequate testing. My sister still hasn't been tested there, so that's basically what I wanted to say. That I appreciate all that. I can hear the sincerity. I'm so thankful for this meeting today, and I just hope that this nursing home will be made to do the right thing, and that no more innocent people will lose their lives over this nightmare that we're all in. So that's what I wanted to say. Thank you.
Thank you for coming up to be a part of, for calling in to be a part of this. Appreciate it.
My pleasure.
Sylvia, can I just comment really
sure,
quick? I just want to share your concern with the talk of giving some of these facilities immunity to prosecution, and the one thing that the governor can't do and the state can't do is give immunity to federal prosecution. So we'll be exploring all our options.
Okay, I appreciate that, because I'm very worried that it's just going to give them carte blanche to continue putting our loved ones at risk.
I agree. We will, like I said, we'll be exploring all our options to making sure that we protect them.
Thank you.
Our next caller is Emil from Hamburg.
Yes, hi. Good afternoon. Thank you for taking my phone call. I actually have a couple of questions. My first question is, I looked at the agenda online before the meeting and it was empty. It's quite hard for me to A, attend a meeting that I don't know what's it about, and B, not being able to follow through a timeline. I would like to ask you if you could provide a timeline or an agenda that has information in it, so this way it could be easier on the public to know what they're going to discuss, and if needed, just like I did, take time off from work to come and call and talk about this stuff. Second, coming to the National Guard issue. New Jersey National Guard was actually called up to duty March 20th, plus or minus a couple of days. I just want to know, why is it taking Sussex County so long to ask for help from National Guard? Also, what is the breadth of the help that you need from National Guard, because they encompass various myriads of help available, especially when it comes to going into daycare centers where people need to be trained how to deal with patients. And the third thing is, if you are calling the National Guard for the Andover, why aren't you doing the same thing for Homestead? Because I guess they are smaller than Andover, and about a quarter of their patients have been testing for COVID. Also, concerning the testing site, it's been almost 2 months that New Jersey has started testing. My concern here is, just like the gentleman said, that people in Sussex County, A, don't have jobs that have insurances to cover their testing needs, B, don't have the transportation necessary to get to the testing site, and C, don't have proper identification to get tested. Is there any way that anybody in New Jersey, and I'm not talking about Sussex, is working to get people that are residents here tested? Because last time, and I remember this, and people get infected, and nobody asks for anybody's ID when they go to Walmart or if they go to Home Depot or go to Lowe's. I just want to know, and this is for protection of myself and the people that I deal with on a daily basis, my neighbors, is when are we all going to get tested? Because there's a lot of people that are asymptomatic. My wife is an ICU nurse. She's been dealing with COVID patients for the last 2.5 months. And I've been at home. I quarantined myself because I don't know if I'm asymptomatic. I have not left my house. I just want to know when we will be able to get tested. And that's something that probably you gentlemen and ladies should have talked to Governor Murphy about. I also don't understand why these letters are being sent in May and not being sent in March. I got sent home from my work March 15th after the reserves, the Federal Reserve, the U.S. Army have told us that everything is being suspended. I just don't understand why May is when you're starting to send letters. Thank you very much.
I can answer as far as the timeline for the request. What originally the governor in the middle of March had put in the request, I believe on March 27th, we received the response back from the federal government saying that yes, the request was approved with a letter that gave basic details about what it could be used for. At that time, Governor Murphy had announced that he would be deploying, and then there was mention at the press conferences that they would be deployed to perhaps help in staffing situations. So those conversations, our conversations were not submitted in a formal letter. Those conversations were submitted through our own phone calls, our state representatives asking if that was at all possible. Now, we saw our neighbors in Pennsylvania actually had individuals deployed, and we saw here in New Jersey in the veterans home that they were deployed. As you heard before, the report came out from the state first that staffing at Andover was no problem. Twice we heard that it was adequate, and we knew from information from individuals that work there or have family members there or actually are residents there that might not have been the case at all. So at this point, with lack of action from the state, from any requests that came via phone call and conversation was not recognized or acted upon. So that is why this has been delayed to this point. Again, we're requesting for assistance in the capacity of, and the National Guard has a litany of different services that they are actually able to offer, but one is staffing, another is training of staff who currently work there in both patient care and preventing transmission and in proper sanitizing of the building, in scheduling and being able to segregate populations of infected versus non-infected. So there's a list of things that they can do, and what we are asking for. And again, on the Freeholder board, I am not a medical professional. So again, these are medical professionals that would best be able to analyze exactly what's needed. But in the absence of the state giving us a remediation report, we literally are pulling out of thin air what we think needs help, and it's certainly substantiated by individual reports from inside the facility. So again, not having transparency, not having the information, not having remediation reports available to us makes it very difficult to know specifically what we are asking for. But we do know that they do cover a broad range of services that can help.
Yeah, I can mention that also. One of the things you have to realize that we're a government agency, right? We are here to give services to people, but we also have to follow state regulation. So the first approach was to work through the system. And then we realized the system was broken, so now we've changed our approach. So that's why you see things happening differently. As far as the different types of services that we want, I outlined that in the letter, and I'll read them again. We want them to feed and care for residents, disinfect and deep clean the nursing homes. We want them to provide janitorial services, audit sanitation methods, implement infectious disease control measures, and provide testing and training to halt the spread of the virus. Those are the things that we're working for and asking for from the National Guard. They have, in the past, performed these services that I read from other states, and they were very successful. And we want to ask the governor now formally to allow them to come in to perform those services here for us as well.
Sylvia, can I just add something? Because, you know, we took the time today to have this special meeting to try and get some things done. And, you know, there's on several occasions we've been accused of trying to make this political by asking for people to be responsible for what they're supposed to do. But yet, we're going to have people call in and ask us, why didn't we have the insight? Why did we not know that this was going to happen? Why did we not know the state was going to not be able to respond and fulfill their duties and ask for help in March for a problem that didn't exist yet? That's a ridiculous question to ask us when it's very clear that in March nobody understood that this was going to happen. Not the state government, not the federal government. We knew there was a problem, but nobody knew what would come from that problem. So that's an unfair question. And to call and say that you couldn't see an agenda, but you took off work to talk about something that you didn't even know what was going to be talked about, and then say you're not at work anymore, it's just not fair. It's not fair that you're going to organize people to call and just cause problems when we are clearly.
No, listen, I'm sorry, I'm going to interject here. I am not at work because I am working from home and I have to put a pause on it. Now, if you are trying to say that this is an unfair question, then please provide the documentation that you have done everything that you need to do to make the lives of people in Sussex County easier. Yes, you do. You are an elected official.
We answer to the people, not to you individually.
Exactly. And who am I? I am the people.
Listen.
So spare me.
You're saying, why didn't we write these letters? Why didn't we write these letters in March? Why did we ask for the National Guard
to come? If you knew that this was going to be an epidemic of these proportions, then maybe you should start taking some headway of saying, hey, this could happen. Maybe we should have this in place.
So we should have known the state was going to fail to perform their duty.
No, you should have known that you have vulnerable people in the county. There's how many people were approaching? 1,000 infected people. 1,000 infected people. And deaths. 2 more deaths yesterday. So what are you trying to say here? At 2 o'clock in the afternoon,
what I'm saying
having this meeting?
Is that in
2
March,
o'clock in the afternoon? 2 o'clock in the afternoon. Try to do what? This is outrageous. This is outrageous. It's impossible to even, this is not political. I'm not affiliated with any political party. This is stupid. This is crazy. You're putting more people in danger.
Sir,
you didn't know what happened.
Excuse
me.
I'm sorry, but we have 5 other callers you have gone way past your time.
I'm sorry. I apologize.
I would like to call excuse me, I'm calling the next caller. Thank you for your remarks. Miss Christy Levin from Hardiston, are you still there?
I am.
Thank you. Your time has started. Thank you.
Okay. First off, I would like to comment on the proposal for the National Guard. I think that most people that are on the call would agree that proposal, regardless of what side of the aisle you're on, I think we all agree that would be a resource that Andover very much could use. So I very much support that, and I know that in the governor's comments, excuse me, he's made comments in the past that said that he was contemplating that, I believe. So I'm hoping that he will be open to your letter, Freeholder Fasano, and I very much support that. Also, Freeholder Hertzberg, what you had spoken to about the task force, I think that also is a very good idea. You had mentioned, I think, law enforcement in terms of the task force. I would urge family members being a part of that. I think that family members are a very important resource in terms of what's taken place. Also, in terms of family members, I think back at the last call, I remember a gentleman who didn't want to give his last name. His name was Mike, and he gave a very moving, he spoke about his mom, and I was moved by what he shared. I think it's really critical that regardless of how we feel about the opinions shared, anyone that talks about their family members still being in Andover, we have to just really try to put ourselves in their place and really think about what that must be like. And just try to show compassion. And I think about Teresa Brady, who just spoke. And regardless of whatever opinions we may have had about what she shared, just think about she has a family member in Andover, and we need to show compassion. So I wanted to share that today. And also thinking ahead of the other nursing homes we have in our county, the Homestead. So not only
1 minute.
Thinking about Andover, and I'm very pleased about the proposals that you made, but looking ahead at the other nursing homes that we have and being proactive, and what the county's looking to do for the Homestead and Bristol Glen and any other vulnerable populations that we might have. I know that this isn't easy for anyone. I know I've learned a great deal myself. I shared last time that my uncle had passed away in Andover. And when I think about Andover 2 in particular, what I learned is that there were people in Andover 2 that were far more vulnerable than my uncle, that may not have had what my uncle had, which was someone, family that were advocating for him. So I think that it's so critical that as a community and as, as freeholders, that we need to be those people that advocate for the vulnerable population. Thank you.
I'd like to just answer that, Christy, a couple of things. One of the reasons that things are changing a little bit, especially in the other facilities, is that the governor has said this past week that he is going into all of these facilities and they're going to be testing everyone, people with symptoms and people without symptoms. And that's what needed to be done initially here. That's why the other states did so well and were able to contain it, because they got the National Guard and they got testing in there early when they only had very few problems. So the governor said he's going to do that. So we can see in a couple of weeks if that's happening. The other thing I want to say is about compassion. I've worked on a lot of boards. This is my 25th year in public service, and I got to tell you that the people I work with in this county and our Division of Health and all of our different agencies and this Freeholder board are extremely compassionate people. You are now hearing our frustration because we try to work within the system that we are obligated to follow as a government agency. Now we're getting out of that system and we're working on our own to fight the system that's supposed to be helping us.
I understand
when you talk about compassion, please let me finish. You don't know the sleepless nights. You don't know the phone calls that go on to 11, 12 o'clock at night. Where are we going to go? How do we get help? Waking up the prosecutor, calling the senator in the middle of the night because we're getting calls. This goes on every day in our lives. So today we may sound angry, but today we're taking a step that we are taking to now just write a formal letter. We're tired of going through our senators. We're tired of going through our Congress. We're tired of going through our other representatives. We're sending the letter ourselves.
I appreciate that, but people that are losing family members deserve to be treated with respect and compassion. That's all I'm saying, Sylvia.
Exactly. Okay, thank you.
Our next caller is Karen Masner from Hoboken. Ms. Masner, are you there?
Yes, I am.
All right, you can start.
Thanks so much for listening to me. I'll try to say as much as I can in 3 minutes. I have a loved one in Andover. I want to first say that this isn't a Democrat or Republican issue. I've talked to Democrats and Republicans who are in your county, and of course, Representative Gottheimer, and everyone on every side of the aisle from your area is really trying to help. So I don't think anyone should bring up politics. I mean, I know it comes up, but I see people on both sides who are very concerned about the residents. And every day that goes by is another day that the disease is spreading and lives are not being saved. And I don't think saying, let's look back a few weeks from now, or we're going to see if they respond to our open request in a week. They should be, pressed to do something tomorrow or yesterday, not, and I know this, you're doing your best, but I think specific questions should be asked. If the state is asking for the National Guard, when are they coming in? How long are they going to wait for them to come in? Every day I see statistics. 5 more people in Andover Township passed away. Families, staff members are going in and out of there. They're not people. If people are not tested, I've heard from my relative who luckily can tell me some of what's going on. A lot of people are sick and can't tell their relatives and can't speak for themselves. My relative in there tells me people are not tested until they display a high fever. So someone could be a staff member could be asymptomatic going in there with the disease. They don't have a fever until 5 days from now. They're bringing it outside. They're bringing it inside. We need testing, and there it is being done in every state, other states, and we can't wait weeks for it. So I want to, and this, none of this, nobody's having a fault with the staff. I don't want the staff to be defensive. They're not the ones that are running things. I love that the staff cares so much about our family members, and they're taking great risks to stay there and help. I think instead of talking about, and I see the state talking about this too, we're going to learn lessons from that, and this is what happened, and I see newspaper articles about who's to blame. I think the
1 minute.
I think the who's to blame has to wait a few months, because I think what we need to do is talk about clear solutions tomorrow and the next days, so that on Mother's Day and after Mother's Day, our mothers aren't gone. We don't have to lose any more people in there. So I think there are 4 solutions. One is get people in there to sanitize. The National Guard has already gone into other states and done this. If you have even 2 National Guardsmen, it doesn't have 100. The military doesn't allow some of the stuff to go on. I'm hearing that people are in the same clothes there for weeks. I don't know if it's true. If you have 2 people from outside in the military, they're not going to look away from stuff like that. They're going to organize and bring order and fix it. To start testing everyone, staff and residents, don't wait until they're spreading it. 3, the state may say, they have the proper level of staffing now, but they're not following the state orders to communicate with family members about each new case or any new cases. The only communication was on over a month ago on April 2. They sent out letters saying, hey, we have COVID here. Maybe if you create a task force and do it quickly, you can appoint someone every day to give an update to family members, because the facility's not doing it. And I talked with someone at the state long-term
Your time is up.
Okay, the state knows they're not communicating with us. Thank you. Please watch over our mothers for Mother's Day and after. Every day that goes by, more people are dying and spreading this.
Thank you very much.
Thank you. Our next caller is Katie Rotundi from Hampton Township. Ms. Rotundi, are you there?
Hi, yes, I'm here.
Okay, please start.
I just had 2 questions and a comment. My first question is, I'm curious why there's no one from the Office of Emergency Management on the call. And my second question is whether or not the timeline that we've been provided over the phone today is going to be provided publicly. And then my comment is that I understand that you're all frustrated. We all are frustrated. My grandfather's dying right now from COVID. I've had it myself, and I had it very severely, and I'm still recovering. And I think that now more than ever, your frustration that you're feeling, while valid, imagine the frustration and pain that the people who actually have it and whose family members are there are feeling. And so I don't think that Christy or anyone else was trying to accuse you all of anything, but just sort of, I ask that you to have a little bit more decorum and remember that there are people on this call grieving and also people on this call who are sick.
Thank you. Our next caller is Kirsten.
I had 2 questions. No, I asked 2 questions.
All right. Yeah. You have let me just reset. You have 2 more minutes then.
We don't have our OEM.
Well, I had already asked them. I asked why there wasn't anyone from OEM on the call, and also
we have our administrator.
Will the timeline be made available publicly that has been talked about throughout this call that we haven't seen?
We have our administrator from Health and Social Services here that gives us all the information. She works every day with the health department and with the public health nurses. Greg, who's still on the line, our business administrator, works with OEM and with the sheriff every day. So Greg is on the line, and he can give you all the information you need from OEM. He's a part of their group every single day. So they are represented.
I understand that, but the OEM is the department that's officially in charge of testing sites, so it's just strange to me that no one directly from the OEM has been on the call.
Well, Greg Puff was in charge of testing. OEM was supporting his efforts. So it was a little opposite for us.
The state puts it's the jurisdiction of the Office of Emergency Management. I know that for a fact.
Okay, that's fine. What was the other question? I'm sorry.
If the timeline.
Sylvia, may I speak? I'm sorry. I apologize for interrupting.
I had my question answered. I'm fine. I just wanted to know about the timeline, please. Thank you.
Right. Again, as far as the Office of Emergency Management, this call was actually not about the testing. This meeting was not about the testing site. The agenda listed the single item of Andover Subacute, and now people have questions about the testing site. So
no, not about the testing site. The Office of Emergency Management brought PPE to Andover Subacute, and then people from Andover Subacute staff said that it wasn't distributed. So, which is not their fault. I know that the Office of Emergency Management and Sheriff Strada brought the stuff. It's the fault of the people for not distributing it, but it wasn't followed up with, and Andover Township Police handed it out while people were coming in during their shift, so it is relevant. They cover more than the testing site.
Yes. No, I appreciate those comments. But again, the Office of Emergency Management, again, is represented on this call. If there are any questions about that, we could certainly answer that for you. As far as that timeline being released, I don't see an issue with that at all. I just have to speak with Terry and Greg about the format for that, but I don't see an issue as long as it doesn't contain any personal identifying information, just like would be done in an OPA request. So, I don't see an issue with that at all.
Yeah, I think that would be great, especially because I agree with the last person who spoke that, it's just great that things are moving more now. So thank you.
Sure.
Okay, our next caller, Ms. Kristen Dunbar from Sparta. Are you there?
Yes, I'm here. Hello. I am speaking on behalf of a very close relative who works in the ICU at Newton Memorial Hospital. And I know that the focus and the agenda is on the Andover Subacute 1 and 2. But I have an issue that I was wondering if you were aware of. And it was my understanding that Freeholder Petrillo said that we could bring up a broader range of things at the end of the call.
Yes, you can.
Okay, thank you. All right, so I just wanted to know if you all are aware that there are workers, these are COVID workers at Newton Memorial Hospital, and they are not being given the N95 masks to use as recommended and approved by FDA and the CDC, that they're having to reuse single-use masks. And my question originally was going to be, does the Andover Subacute Hospital Care Centers, do they have the masks, an ample amount of masks? Because these are only single-use masks. And my daughter...
1 minute.
...is having to reuse her mask over and over again. So I really related to what you said when you said that sometimes up here in Sussex County, we're left out and we're the have-nots. Because I do know for a fact that other hospitals in our area do have ample N95 masks, but Newton is not one. So if anybody'd care to comment on that, and if you could do some networking,
Christine, what is the position of your daughter?
Respiratory therapist. She's the one that intubates people.
Okay, I will find out.
Thank you so much. I really appreciate that. And we all can't get better, unless we take care of everyone, especially our healthcare workers and the patients that they're serving.
Absolutely. Yes, I'll call the president tomorrow and find out what's going on.
Okay. Thank you.
You're welcome.
We have a caller, Abby. Is it Gross from Morris County?
Abby had to leave the call, but I am her aunt on behalf of my brother who's at Andover. I'm actually in Connecticut.
Okay, I need you to identify yourself, please. And
Sure. My name is Barbara Kasha, and as I said, I'm out in Farmington, Connecticut.
Okay, Barbara, thank you. Ready to go.
Sure. First of all, I want to say thank you to all of you for putting this call together, allowing us to be on. This has been eye-opening for me personally, and at times very brutal listening to this, to all the details. I get your compassion, I get your dedication, and thank you for being there and doing this. The mayor, the Andover Police Department was very helpful when the news broke early on, so we very much appreciate them as well, and all the workers involved, and the staff at Andover has been wonderful. I think, I don't know if you guys are able to influence this in any way, shape, or form, and another caller kind of referred to this as well, but the greatest frustration as a family member, excuse me, and especially being so far away, is the lack of communication from Andover for the family members. I've mentioned it briefly just this week on a call that I had with somebody at Andover. In this day and age, to have email addresses, just send out a perfunctory email once a week to let us know what's going on, what changes are happening, what just any bit of information sitting, at a distance. We can't go visit. We can do phone calls. And I am going to be doing a Skype call tomorrow, which I am very happy about. If there's any influence to make that happen, that would be a real boon for all of us. And that's really what I wanted to say. So thank you all again for what you're doing. Really, it is appreciated.
Thank you very much. Is there anyone else that would like to speak?
I don't know how to interject. Am I able to speak?
Yes. Just give us your name and your township.
Carlos Oasis, Byram Township.
I'm sorry, could you repeat yourself? The connection was poor.
Let me get you off of speakerphone. Carlos Oasis, Byram Township.
Did you get that, Terry?
Yes.
Okay.
Okay.
Go right ahead.
I want to say thank you to the Freeholder Board for everything you're doing. I, for one, am staying connected by staying on your website and seeing new information coming through. And I also want to say thank you for getting us a test center in Sussex County at the college.
Thank you very much. Is there anyone else that would like to speak? Okay, not hearing anyone, could I please have a motion to close the public session?
So moved.
Hertzberg.
Second? Is there a second? Anthony?
Second was a Freeholder Fasano.
Yes. Any discussion? All in favor, please signify by saying aye.
Aye.
We do not have any executive session. So before we close, I would just like to thank everyone again for calling. We understand these things are extremely emotional, but we also understand that that you need to hear as much as you can and be given as much information. We tried to do that today. And as we move forward, we're going to continue to fight for all that we need and all the help that we should be getting from different agencies, and we will continue to give you the information as we get the information. So with that, I need a motion to adjourn, please.
So moved, Anthony.
So moved.
Is there a second?
Second, Hertzberg.
All in favor, please signify by saying aye.
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 Thank you. That completes our meeting tonight, and be safe, and thank you again. Bye.
Thank you all. God bless.